Hey guys, it's Dr. Greer. I am here for my Friday Facebook Live, but you guys may notice I'm doing this on my personal page. I have noticed that my post gets seen by a lot more people on my personal page, so I'm going to try doing it this way and then sharing it to my business page. Let me know if this is something you like and if you're seeing more of it. I know Facebook's algorithm can be a little bit tricky for like business versus personal pages. Anyway, you guys know I love talking about everything plastic surgery, and today is no exception. Today I'm going to talk about eye lift versus brow lift, because this is a really common question. People come in and they're worried because their eyes look kind of tired or their eyebrows aren't sure what the right solution is. So I'm going to explain that today. Now, eye lift and brow lift are both procedures that address the upper third of the face, and that's in comparison to facelift, which really only addresses the lower 2/3. So if you have kind of tired looking eyes or saggy upper eyelid skin, it's quite possible you need an eye lift. You may also need a brow lift, and it's actually very easy to tell. What you have to do is totally relax your forehead, which I can do because I'm Botoxed and it doesn't move anyway. But when you do have your eyelid brows start to droop, a lot of us compensate by raising our eyebrows all the time. So with your forehead totally relaxed, just feel where your eyebrows are. If they're a good like centimeter above the rim of your brow bone, then you're in good shape in terms of eyebrow placement. Now for guys, your eyebrows are a little lower. Women have a more natural arch. Not me, mine are totally flat, but it's normal for guys' eyebrows to be a little bit lower. If your eyebrows are down below your brow bone, or if they're at your brow bone and you're a woman, you may need a brow lift first. And that should always be done before the eye lift, because what happens is the brow dropping makes the skin on the eyelid look droopy, and if you lift the brow, then you're in better shape. That can be done through a couple of different incisions, either in front of the hairline or back in the hair, and that kind of depends on where your hairline is and what you look like. Eye lift is generally if you've got excess skin over your eyelids and your brows are in good position. So sometimes people need both. Often they'll need one versus the other. Upper eyelid lift just takes the extra skin off the upper eyelid. Lower lift takes some of the extra skin out and some of the fat as well. Actually, upper does take some fat as well. So circles under your eyes or bags under your eyes are going to be more lower lift, and then excess skin over the upper eyelid is going to be more upper lift. Now, I've also had people ask me about getting a brow lift with Botox. Botox paralyzes muscles. So by giving a little Botox right here at the eyebrow, we actually weaken the muscles that close your eyes tightly, and that allows your forehead muscles to lift them a little bit. I can usually get a millimeter or so of lift. It's enough to look a little bit lighter, but it's nothing dramatic. So it generally tends to work best in younger people who don't have a lot of extra skin or sagginess on their eyebrows. I hope you guys found this helpful. I will try this again next week on my personal page, and I'll be sure to share it to my business page so you can see it. But I love answering questions. So if you guys have any plastic surgery questions, leave them in the comments or shoot me a message, and I would be happy to answer them next Friday. Take care and have a great weekend.